On this Doctor's Day, we bring you an incredible, important, and often overlooked discussion. Urological health. We are honored to sit down with a highly respected Dr. Madappa, a leading urology specialist, to demystify conditions affecting the urinary. From common issues like UTI and kidney stones to crucial topics like healthcare and transplantation of kidney, Dr. Madappa provides clear answer and practical advice and vital insight. This interview aims to break the stigma surrounding urological conditions and empower you with the knowledge to take charge of your health. Happy to talk to you in this video, meeting with Dr. Madappa, who is specialized in urology. And today I'm so happy because the Doctor Day. As most of the people, they don't recognize in the society the heroes of doctors are seen behind the heroes. So now one of the most prestigious college, hospital and for the urology and the dental and all. So urology and other specialties are there in the Sigma hospital. So I'm meeting with the one of the surgeon here and who is specialized in urology. So let's go and ask questions and how they are professionally exercised and how do they come up with a great enthusiasm in this field. So first of all, sir, if I come to general and personal questions, journey into medicine field. So how you get into this field when you were young? So what made you to get into this doctor field journey?
Yeah, doctor's profession is a noble profession. It's a profession where you can do is see a lot of people, get to know about their problems, try to help them out, and if you really want to do service to humanity, I think we know the profession is better than this.
Yes, yes. Of course, this so most of the people like they feel like doctors means God. Like when they are in a difficult situations.
That is wrong actually. Doctors also just
no, some people they made because when they get into the difficult situations, I mean
they think like that, and then they keep thinking and hoping that it will not be that it will not be possible for a doctor to save somebody's life when they are really going to die.
Yes, yes.
You cannot save someone who has gone to an extreme level, and then there's a main problem now.
Yes.
People come thinking that we can save everybody's life, and you should know that people have to die.
Yes, yes, yes.
And they die most of the time nowadays in the hospital.
Yes, yes, yes.
Because nobody keeps a serious patient at home. They take to the hospital.
Yes.
And patients will die. But most of the time, when they are sick, they have a lot of pain, they are having infection, they have got cancer. We can treat that and pull them out of that serious condition and then save their life in those situations. But some of the serious problems and at the end stage, you cannot save anybody just like that. You can prolong their life, you can take care of their pain, but we are not God. We can't do God's job. Okay? We'll only help them to recover from pain and illness, but not all of them will survive.
Okay. So when I come to a day, every day is different. Each day is different for every doctors. If I come to, can you describe a typical day for your as a doctor?
Typical day starts in the morning around 9 o'clock. And we see patients, outpatients. We have inpatients, operated patients. We do rounds and then look into their problems, give them advice, give them medication when they have pain, and then we do surgeries also. We operate on patients and relieve the problems with what they have come with. I treat patients with kidney problems, stone problems, cancers in the kidney. I do kidney transplantation also. So that way we try to heal them.
Then
so any general days like inpatient care, outpatient care, and operations.
So since doctors have so much of kindness for the patients, I could see so many doctors have like even in the talking, the way gestures the patient involved in. So most of the patients are attracted to even to that one. So next, if I come to the challenge and rewards, so what are some of the biggest challenge you face in your professional and
challenges of patients come in very serious stage.
yes.
And we will not be able to give guarantee that they'll survive.
Okay.
Some of them survive,
Yes.
some of them don't survive.
Yes.
So the challenge comes when the patient doesn't survive. The patient's relatives don't accept it.
Oh,
They'll try to put the blame on somebody.
yes.
They want to say that the doctor did not give the right treatment, did not give look after the patient properly, although you have done everything best.
Yes.
And there is negligence and the patient died and they try to blame the doctor. Not all of them.
Yes.
Some people do that.
Mm.
That is the biggest challenge in our profession. Not only for me, for everybody. The gratifying thing is we do a lot of big operations. For example, kidney failure.
Oh, yes.
We put a new kidney, they become alright and then become normal.
Yes.
Then that's how things are very good.
Yes. If I come to the kidney operation and all, the stone formation, so what would you suggest for the stone formation to not to take place in that in their life?
Main thing is drinking water,
Yes.
especially in summer. Keep drinking water every hour. That will prevent stone formation. Majority.
Majority.
There are some other rare illness which can give rise to stones. We can find out and then treat it also.
Oh.
So main thing is water drinking and then avoiding some food stuff, not many, like non-vegetarian food is not good. Stone formation is more common. Eating too much of salt
Sorry.
is not good.
Okay.
And food with excess calcium
Yes. Yes.
and proteins,
Protein.
these things not very good for stone formation.
Stone formation. Okay. Then if I come to this particularly for the urology, and there's some most of the students want to know that their daily life, like if there are some students having passed the urines like white color and the yellow color and some different way of
Yeah.
like,
Normally the urine,
so what would you say?
urine is supposed to look like water.
Uh,
When you don't drink water, too much of water, it will become yellow.
oh yeah.
So yellow color means urine is concentrated
Okay.
and stones start forming in yellow color urine.
Okay. So could you elaborate on the stone formation of how they get involved in the operation, and even technology has improved a lot, and even in using technology also they destroy the stone formation
Yeah.
in itself.
Stone formation prevention is by diet and drinking a lot of water. Nothing
Yeah.
else we can do. There are some medication also, but we can't take medication every day. Correct?
Yes.
Once it is formed, we have to treat that. There are some medications available to treat small stones. Bigger stones which are already troubling, cannot be treated with medication. We try to remove the stone. There are a lot of different technological advances and we have different modalities to take it out.
Yes.
Nowadays we don't operate. Previously, say 20-30 years back, only open operation was the procedure first to remove the stone. Now we don't operate at all. We have got different endoscopes,
Okay.
lithotripsy machines and laser, etc. So we powder the stone.
Oh yes.
When you powder the stone, the small fragments will come out in you.
Oh, okay. So now technology has improved a lot. So that made us so much easier. to
Now surgery,
come.
operation for stones is
Not much difficult.
not even 1%.
Yes. It's normally it can done like then after operation 2-3 days it can
No,
get
1
into
day, 24 hours.
24 hours. Within 24 hours they can get into the work. No problem. It's a very good technology. They have improved a lot.
And you can do that any number of times because we are not cutting the body.
Yes.
It's all endoscopic procedures,
Yes.
so no damage to the body.
Oh, yes. And if a memorable moment, if I come, could you share a memorable patient interaction, like 2-3 patients?
There are many, like, people who have really died and then come out.
Oh,
We have had patients. People who
So recently, which you admit.
We had a young girl who came with kidney stone with infection.
Okay.
She was only 22 years.
Oh.
We had removed the stone and about to send her home. She collapsed in the ward.
Oh.
When we found out that there was a lot of pus inside the kidney still there.
Okay.
And then we brought her to the ICU. She was actually dead.
Okay.
So we gave the treatment which recovered.
Okay.
So those are things which are and kidney transplantation, we give the kidney, they become normal.
Okay.
In 24 hours they become normal. 24 hours.
Okay. So if I come to the kidney transplantation, so if there any person like who are willing to give the kidney, that means what are the procedure you need to go through or
person related to kidney, give the kidney should be only relatives. We don't take from unrelated.
Okay.
That is not legally valid.
Oh, that is the main thing. Only relative can donate the
Blood
kidney.
relative.
Blood relative.
We do tests for the person. He should be normal.
Okay.
He should have 2 functioning good kidneys.
Okay.
And we'll take one of the kidneys. So the person who gives the kidney should have a good kidney to survive also.
Oh yes.
One kidney is enough for living normal life.
So both.
Anybody who is more than 18 years of age can donate a kidney.
Oh, okay. So like both functions will be held in only one kidney, like usually.
No. Every man has every person has 2 kidneys.
Okay.
And we do not need 2 kidneys.
Okay.
One kidney is enough. One kidney is more than enough. Even for normal survival, one kidney is also not necessary.
Oh.
Maybe 3/4 of the kidney is enough.
Oh, okay.
That is extra.
Oh, that is
If
extra.
there is any problem in one kidney, to safeguard the person, people have given 2 kidneys.
Oh, okay. Still they are surviving after the giving. They live long
The
life.
person who has received the kidney also will normally
Okay.
live normally, and the person who has given the kidney also will live normally.
Okay. This is the main thing, friends.
Otherwise, how can you take the kidney from a normal person and
Yes.
put him into trouble? No.
Yes. It's a very good thing that we know from the doctor surgeons. That is the main thing. Is 2 kidney is important, but 2 kidney are not important in our body. But the thing is, if we want to survive, only 1 kidney is enough. The thing is, we need to maintain like food wise and all. What will you give advice for?
No, there is
food
no
and
special
all?
advice. Must take care that nothing, that he doesn't get infections, stones, etc. So
Oh
some
yes.
precautions.
Precautions will be taken. Then if you come to doctor-based tests, significance of this day. What does a doctor meant us to personally?
Supposed to be Doctor's Day, so
Yes.
everybody remembers doctors are only on this day. All other days they talk about the patients only, not about the
Yeah, so.
It is nice to be remembered.
Yes.
We keep working inside the hospital all the time and helping patients.
Yes.
Only people who have come in contact with the patient, the doctors, and then get the benefit, they may understand what is the benefit of
Yes. Of
a
course.
good doctor, a compassionate doctor.
Yes.
General population may not know about it unless they
No.
really experience that.
Yes.
That's important for everybody to know what and how they work.
Mm.
Every doctor will be trying to do good only to
Yes.
the patients, the
Yes.
people who come to them.
Yes.
But some people think that the doctors are bad. They kill and they produce
Yes.
complications. No doctor,
Some of them
will do that. Maybe complications can happen. The engineer builds a big building and the building collapses.
Yes. Of course.
Nobody talks about that.
Yes. Even those who know about the only for professional kind of, they will know that. Those who are not educated in this area, so they don't get
No,
into that.
because life is involved in this, so everybody wants to get every patient, every person in the family cured and then take them home alive.
Yes.
But that they should understand that every person has to die.
Yes.
And nowadays people don't die at home. They die in hospital. So they try to blame the
This is
hospital that
yeah.
something could have been done and saved the patient. Doesn't happen like that.
Yes.
So in the ICU, some people die, many recover and then go home.
So if I come to like, what would you give suggestion to your colleagues, like your under assistants? And
Only I tell them that you study, tell everything to the patient and the relatives that what is the problem.
Yes.
and also tell them the risks involved in some operation. Don't guarantee everything that nothing will go wrong. That sort of thing is not possible. Things do go wrong. Every operation that we do has known complications all over the world, including death. That's the complication. It's not negligence always. Okay? So they should understand that and make the patient's relatives aware of that there are complications. One injection can kill somebody. A reaction can happen and the patient can die with one injection.
That is the most thing, that when they are there, so that means all the colleagues, they need to be supported in the basic level.
They should help each other.
Okay. Public appreciation, if I come to, what's one thing you wish the public to understand the better about the medical profession and urology profession?
Public should, nowadays everything is available online, people can find out every specialty, every problem, they can understand the things written in simple language, any language for that matter. So they should be aware of different problems, and when they come to the doctor, they should come for relieving the pain, getting rid of the infection, and getting rid of the problem as such, but not always expecting doctor to be called. That's not possible.
Then finally, could you elaborate how you got the vision of a doctor as a young person, as a young student, not expected or unexpected, getting into the surgeon level and being
I always wanted to become a surgeon. Before I became a MBBS doctor, I wanted to become a surgeon.
Oh yes, you had when you were young.
Yeah, that is the thing. What, somebody say I want to be a pilot. They want to fly in the sky, Like that, everybody will have some kind of a vision. So I wanted to become a surgeon.
Oh, you had that vision, and you completed it, and you mastered it, and become something for the society. Like even in the after your life, there will be more people who is going to be remembered. Even I myself be one of them. And I want you, so sir, to encourage young people who are medically professional, want to join and to continue as MBBS students or getting into the urology or any other professions like in such as doctors going to the departments. Could you encourage young students?
Not like encouraging, but people should have that temperament and attitude. If somebody doesn't like to see suffering, sick patients, injuries like road traffic accidents have injuries like anything can be seen, cut off a limb or injury in the head all over the body. They are all not simple things to look at. Bleeding patients, all that is very traumatic. Not everybody like that. People should be tough enough to tolerate that, and people should be ready to work long hours. So with in this profession, personal life, family life will be affected.
So when I come to the personal life and family
all
life,
that should be thought of before joining medicine.
Yes. I see so much of experience got in your lives. Like how do you manage everyday life with your family, even involving? Sometimes it's difficult to get into the house when you are on the duty and the child.
There will be compromise. You can never say that you will do all the family obligations along with your good profession. There will be some lot of functions, lot of important functions. You will miss so many other important family things, social things in this profession. It's difficult to manage and maintain.
Even when the difficult situation comes, you have to run to this hospital. Like patients will be waiting. Like if it is not possible, that means they will be in another mode.
They get angry also.
They get angry also.
So once you give an appointment, you should be able to
ready for it. Yes. It's like if I come to importance of technology and future of the healthcare. So what is most advanced in technology, using technology in the field of medical, like doctor profession?
Every field is advanced now. What was was there in 20 years ago, we don't follow it. For example, now, kidney stone removal, for example, we don't cut open it off. We don't cut, there's no cutting option.
Okay.
All mechanized, endoscopic, laser, third operation.
Yes.
That's only one of the important things. Like that, everything is improved.
Okay. So,
Everything, medications are different. Even insulin injection for diabetes,
yes.
we don't go on injecting. There are pumps available which go on varying dose. They calibrates the sugar level and then automatically can give the injections. That sort of things.
Okay. The significance of this doctor's day when I come. This day is marked as a doctor day. So what would you suggest? What would you say about this significant day? Like how it came up? Like who is the reason of this day?
This day was chosen in memory of Dr. B.C. Roy.
B.C. Roy, yes.
Bilan Chandra Roy.
Yes.
He was a great physician. He was a doctor and a great physician, and he did a lot of service to humanity in West Bengal.
Okay.
He was in West Bengal, and he has treated so many patients. He became the Chief Minister of West Bengal.
West Bengal.
He was born on July 1st.
July 1st.
His birthday is celebrated as Doctor's Day because of his great service.
So Sigma Hospital especially noted this one. Mysore very specially, I see so many the videos there, the photos and they kept very specialized and advanced. There are more specialized surgeons and doctors here, and those who are involved in 24/7.
This is recognized for postgraduate teaching also.
It's one of the most important hospital in Saraswatipuram, Kuvempu Nagar, which is opposite to the Kamaxi Hospital. You could come and visit and ask Dr. Madappa sir, and whatever the things urology problem is there. And I hope you will get it suggested. And thank you for sharing, sir.
Thank you.
A happy moment.